Thank you, Dr. Amit, for giving me this opportunity. So today I'm talking against advanced and enhanced monofocal IOL should routinely be used in all glaucoma patients. So I have no financial disclosures. So when I searched upon PubMed finding glaucoma and enhanced monofocal, I could only find 3 results. And if we look at the first study here, it showed very successful outcomes when these enhanced monofocal lenses were used in glaucoma patients. But what was striking here, that contrast sensitivity was not even a part of their primary or their secondary outcomes. Moving on next, this second study, again, they showed very successful outcomes. But if you will look at their stringent inclusion criteria, which had only patients with a very early glaucoma, look at the average mean deviation of only 3.5 decibels. And the stringent inclusion criteria also had that the patient should not have had any change in the glaucoma medications, any change in visual fields, or in OCT over the last 1 year. And with this, they concluded that these lenses are very effective in glaucoma patients. So early and only stable glaucoma. Now looking at the EDOF lenses, again, if you look at the study, they said that the visual outcomes are very good with EDOF lenses, but again, look at the outcomes. The contrast sensitivity has not been analyzed, and look at the average mean deviation in the EDOF group. It's only 1.6 decibel. Are we even calling that glaucoma? And the number of medication was less than 1 in these patients. And not to forget, look at the financial disclosure of the author. Okay, now moving on next. Again, similar, very stable and mild glaucoma and the funding that we can see. So it's very clear that the results here might be biased. Now looking at the EDOF lenses in normal tension glaucoma, it was a small study of only 16 eyes. There was no comparison group. And even in this small group of 16 eyes, they showed that 4 eyes did have contrast sensitivity, which was less than normal. So, and now this systematic review and meta-analysis, which studied about EDOF IOLs, and there were about 1,336 eyes in this study. And these were not glaucoma patients, but they still concluded that EDOF IOLs resulted in reduced contrast sensitivity and more frequent halos compared to the monofocal IOLs. Here, our comparison is not with trifocals. Our comparison is with monofocals. So the pitfalls here are that glaucoma is a progressive disease, and with deterioration in visual field and contrast sensitivity as the disease progresses, these IOLs can rather impair the outcomes in long run rather than enhancing them. These patients are already on a lot of anti-glaucoma medications, which cause them an ocular surface disease, which additionally hinders the contrast sensitivity. Third, the need for there's always a need for trabeculectomy in these patients, or these patients might be planned for phacotrab, so there will be an additionally induced astigmatism. So our purpose of making our patients spectacle independent by using these lenses actually goes useless. Also, many of these lenses are pupil dependent, and we know our glaucoma patients have very rigid and small pupil, and some of these patients might not be suitable for these premium IOLs. Also, these enhanced and premium IOLs come at a cost. We need to understand that our patients are already bearing an additional cost of anti-glaucoma medications and the need for future surgeries. So to conclude, there is a sparsity of non-biased and long-term studies evaluating these lenses in glaucoma patients. These IOLs can actually impair the visual quality in glaucoma patients in long run. They might be suitable only for glaucoma suspects, ocular hypertensives, and early glaucoma with no signs of progression. So coming back to my first slide, I am for advanced enhanced monofocal IOL should selectively be used in only early glaucoma patients. Thank you.